Thank you so much to the Health and Medicine Policy Research Group for this very distinguished award. It's truly an honor to be acknowledged for simply doing what I believe that I was born to do, and that's educate and enlighten my community about all things health and wellness by any and all means necessary. Thank you to my friend and former high school classmate, Ms. Sharonda Kimbrough, for the nomination. To my family, both natural and extended, for their unwavering love and support and for instilling community values and love inside of me. To the HIV/AIDS community for the many years of struggle and sacrifice, for never giving up hope, and for teaching me what I needed to know to stay alive and find innovative ways to share that knowledge with others. And last, but most certainly not least, thanks to God for giving me direction and purpose. Thank you all for being here. Have a great night.
I would like to start by saying how honored and humbled I am to be receiving this award tonight from Health and Medicine Policy Research Group, especially considering that HMPRG has held such an important role in my own professional development. I remember my first time stepping foot in the HMPRG office was as a medical student, attending my first Physicians for a National Health Program meeting, later becoming a Schweitzer Fellow as a medical student, then serving as an advisor to Schweitzer Fellows, and eventually having the opportunity to serve on the board. Through all of these experiences, I've found health and medicine to just be so instrumental to my own professional development and understanding what it means to be an advocate and understanding what it means to partner with community. I know that often there are trainees at these events, so I just wanted to take a few seconds to talk about my own career trajectory. When I started medical school in 2002, I thought I would end up focusing my career on HIV and AIDS. So when I moved to Baltimore and wanted to practice HIV medicine, was told that they had enough providers to treat HIV, but what they really needed was someone who could treat opioid use disorder. I was simultaneously working with the Baltimore City Health Department and the Maryland State Health Department on public health projects, and was being asked to work on opioid-related overdose activities. And the short story here is that I ended up having a career which has been extremely meaningful, extremely fulfilling, very focused on social justice and racial justice issues that are pervasive in the field of addiction and overdose response. But it's not where I intended to be. And I think one of the main lessons I've learned in my career thus far is that sometimes where we think we're going or where we think our interests lie end up not being what's most needed in the community. And that when we're willing and able to be able to take those opportunities as they come, you can make tremendous impact. And I am hopeful that in the end, my work will make impact on the lives of people who use drugs and their families. Thanks again so much to Health and Medicine for this award.
It has been a privilege to work in public health for multiple decades. The continuous effort to remove obstacles and promote optimal health has been challenging, but accomplishments have been so rewarding. Working for Cook County Health at the Ruth M. Rothstein Core Center, the largest HIV/AIDS center in the Midwest, has been the best part of my 4-decade career. I have been able to participate in the progress of the HIV/AIDS epidemic from unsafe, detrimental conditions with great public health risks to a condition that with compliance and medication adherence can reduce the viral load to non-transmissible levels, protecting the community and increasing the lifespan of those with HIV. The advocate and champions who mobilize to raise awareness, educate the public, and demand equity in treatment and access must be acknowledged for their efforts. Because without them, the treatment of HIV/AIDS will not be as advanced today. The comprehensive services provided by the workforce, while encouraging those impacted to thrive, has been amazing to watch and support. The backing of their accomplishments with the National HIV/AIDS Strategy, focusing on reducing disparities, preventing stigma and discrimination, have led to these positive health outcomes. it takes a country to invest in health improvement efforts. We see this with the COVID-19 pandemic and the country's effort to bring this virus under control. I have worked relentlessly with Cook County Health to coordinate the nursing support to vaccinate approximately 900,000 citizens. This effort has contributed to decreasing acute disease, hospitalization, and death. Like the HIV epidemic, COVID-19 will require intense investment and public health support. Cook County Health leaders, thanks again for the nomination, and the Health Medicine Policy and Research Group for the award. It has been a pleasure to serve, and with the positive outcomes because of the intense work, there has been no regrets.
I hope everyone is enjoying the evening, celebrating the good work Health and Medicine Policy Research Group has done over the past 40 years. Can you believe it's been 40 years? It's amazing. I would like to thank Health and Medicine for honoring me for the 40 years that I have worked to improve public health and create more equity and fairness in the world. From my days at the Chicago Women's Health Center to the Illinois Maternal and Child Health Coalition, now EverThrive, and now as a state representative, assistant majority leader, I have always appreciated the partnership with Health and Medicine, particularly with advocating for community health workers and freestanding birth centers. Recently, I have helped to pass laws to expand Medicaid coverage to postpartum persons for 12 months instead of 2 months. Since maternal deaths occur up to 12 months postpartum, health coverage is critical during this period. I've also passed legislation to allow pharmacists to prescribe and dispense oral contraceptives. I've passed laws to change the criteria and allow for new birth centers throughout Illinois, with a particular focus on the south side of Chicago. We've passed laws to include a path to certification and Medicaid reimbursement for community health workers and home visitors. That we have worked on that for so many years together. We've also passed laws to provide Medicaid coverage for doula services, and we are still working on the legalization of home birth professional midwives. While we have taken action on many issues, there's always more work to be done. I look forward to collaborating with Health and Medicine in the future on our shared mission of health equity and social justice.
Thank you so much for this award. I sincerely appreciate your recognition of my life's work. I am humbled by the accomplishments of the group sharing these awards tonight. I must say at the outset that whatever I achieved in my professional journey would not have been possible without the support of my wife, Mariela, and my children, Jorge Luis, Marjorie, and Daniela. Many of us who believe in striving towards social justice must balance the needs of those that we serve with the needs of our own family. I also want to express my appreciation to the students with whom I worked over the past 41 years. So many of them endured racism, sexism, ageism, and other forms of discrimination, and still succeeded in their goal of becoming physicians and other health professionals. I feel fortunate to have supported their goals, and it is very fulfilling to see them serve disenfranchised communities around our country. I would be remiss if I didn't acknowledge my colleagues at the University of Illinois College of Medicine, both those that supported my vision and those that did not. I learned a lot from each one of them. They helped me realize that it truly takes a village to achieve a just society. I am particularly indebted to my friends and colleagues at the Hispanic Center of Excellence. Finally, congratulations to the Health and Medicine Policy Research Group on this momentous occasion in your history. Your work in holding leaders accountable to the communities that they lead is as important today as it was 40 years ago. Undoubtedly, your efforts will be even more critical in the next 40 years. Thank you again.
Thank you to Health and Medicine for honoring my 40-plus years of service to Chicago Public Health. We have worked side by side throughout my career. I participated in one of the first work groups that Health and Medicine ever convened, chaired by Health and Medicine co-founder John McKnight on Medicaid reform, and have continued my association, most recently, on a project examining funding of local health departments. And congrats to the other award recipients, two of whom I've known for most of my career. One of my most rewarding projects at Northwestern Memorial Hospital was working to create what is now the Near North Health Service Corporation, of which Berneice Mills-Thomas has been its longtime leader. And while working at Chicago Department of Public Health, I was there alongside Robyn Gabel as a member of the MSPH coalition she founded and led, the predecessor to EverThrive. Looking back at my career, I have identified two salient features. One, I am proud to be a public servant. To be accountable to the people and not to a board of directors or stockholders has brought to my work an even greater sense of responsibility and urgency. And second, as a trained social worker, I learned very early on of the inextricable link between health and what are now called the social determinants of health. While it has taken a very long time, we are finally beginning to see health and medical care institutions and professionals understanding, and more importantly, addressing these determinants. Finally, thank you again for this recognition of my efforts and accomplishments.
I'm extremely honored to be receiving such an important award like the 40 Years of Service Award from the Health and Medicine Policy Research Group. This is a group that I have known and followed over the years. One who has remained true to its values and its belief that in this world, every person should have access to affordable quality health care, and you never wavered. I, like you, have fought and will continue to do so for individuals who are met with unfair and avoidable differences in health status. Again, I am grateful for the recognition that I have received because I'm sure that every other nominee was or is capable of winning it, if not more so. Congratulations to other recipients, Margie, and the board members who have worked to advance your core values and mission of health equity. I wish you continued success. Thank you very much for this honor.
My name is Peter ORRIS, and I wanted to thank the Health and Medicine Policy Research Group for this recognition. I'm both flattered and honored to receive a 40 Years of Service Award from the Health and Medicine Group. To receive such an award from a group whose mission and accomplishments in promoting social justice and challenging inequalities in health and healthcare is welcome affirmation that my activities have contributed to this effort as well. Health and Medicine's reports, research, educational efforts, support for young healthcare activists, and an unceasing willingness to reach out and create networks and coalitions to secure social change and the eradication of racism in our area is unparalleled. It is unfortunately as true for this century as it was when W.E.B. Du Bois wrote in 1903 that, quote, the problem of the 20th century is the problem of the color line, the relationship of the darker to the lighter races of men in Asia and Africa, in America and the islands of the sea, unquote. Racism is both human civilization's main obstacle to advancement, and when understood, it's its prime opportunity for a more just world. When humans in whatever setting understand that their future is bound up in the equality of all their fellow humans, progress is made in all spheres. When this is forgotten, the past swallows us. This is an exciting time for our country with new understandings of this truth, but fraught with the most serious dangers. I look forward to working with you all for the next 40 years in the most exhilarating human movement for humankind. Thank you.
Hello, my name is Cesar Rowland, co-founder of Illinois Unidos. We'd like to thank the Health and Medicine Policy Research Group for this incredible recognition. Illinois Unidos is a network of more than 200 volunteers addressing the immediate and long-term impact of COVID-19 on the Latinx residents. At Illinois Unidos, our work is to ensure that pandemic's impact on Latinx population is understood widely and addressed equitably. Utilizing our contacts with elected officials, healthcare professionals, and nonprofits, Illinois Unidos has recognized nationally and now being duplicated in other states. Illinois Unidos has assisted government officials and philanthropic organizations understand COVID-19 at a neighborhood level. That work includes advocating for the less resilience on COVID-19 hospitalizations in the Latinx communities as an indicator of our pandemic severity. At Illinois Unidos, we prioritize local residents' roles and community knowledge by exposing them to different viewpoints about science. As we continue to grow, our hopes to expand Illinois Unidos and convert into a resource that can address all community health issues amongst all Latinx residents. Thank you once again for this recognition.
As a resident and proud principal of St. Francis de Sales High School, I would sincerely like to thank the Health and Medicine Policy Research Group for this beautiful award. I accept it on behalf of the residents of the Southeast Side and South Chicago communities that are often unheard but relentlessly fight for its future. A community that values family, a community that has endured despite the lack of resources or opportunities, a community full of grit, my community. Our story is one of survival, but we are tired of surviving and we are ready to thrive. We are fighting for the future of our kiddos, our families, and reclaiming our little piece of the world and adamantly saying, you cannot come into our home and not care for her. There was an assumption that was wrongly made. The assumption was that we, mostly Black and brown faces, did not understand the environmental impact of a company like General Iron. But we did. We had seen it before with the steel mills and what it meant to the health of our community and our green spaces. The assumption was wrongly made that we did not care. We do, and because of that, we marched. We staged a hunger strike. We elegantly spoke at town hall meetings. We petitioned and worked with our local government. We appealed to the press. But our fight isn't over, and we are so thankful that you value our story enough and thought it was worth retelling. Many thanks and have a wonderful evening.
Hi everyone, my name is Olga Bautista and I'm the Executive Director of the Southeast Environmental Task Force. I'm also a lifelong resident of the Southeast Side, and I have dedicated most of my life to fighting for the health and the well-being of people in my community. I am incredibly honored to be accepting this award on behalf of the Stop General Iron campaign. For decades, the industrial corridor near the Calumet River has created conditions that have negatively impacted the health of our residents, as well as the vitality and the beautiful natural spaces that surround us. I think it's fair to say that due to a number of well-documented struggles we have had to directly take on across all of our nearby neighborhoods against polluting industries such as General Iron, the large metal shredding facility that was proposed to be relocated to the Southeast Side, which took a hunger strike, among other historic actions, to put those plans on hold, as well as the piles of harmful pet coke that for years towered over us, that many people outside of our community only see the area around the Calumet River as a sacrificial zone for industry to dump on. They don't see the incredible natural areas that we are immensely lucky to have in our backyards, nor do they see the people and the culture and the institutions that work hard every day to make sure that we have a healthy neighborhood to live in. Residents of the Southeast Side have had to bear the brunt of pollution for far too long. And as a result, we have some of the highest rates of respiratory disease and other life-threatening issues such as cardiac disease and cancer. I myself developed asthma as an adult, and I worry every day about the air quality that my children live in, especially as the data has shown that the 10th ward has been one of the hardest hit by the COVID pandemic. Putting an emphasis on the prioritizing public health when it comes to land use, zoning, and permitting is key. This is one way in which we begin a plan of improving the health outcomes of the residents of the surrounding area. Repairing harm that the industrial activity has done to the nature around us could be the first step in truly prioritizing the health of everyone that lives and works in this community. Thank you so much to our partners at Health and Medicine for all of their support in this campaign, which really took us to the next level. And thank you so much for recognizing our hard work in the Stop Gender Iron campaign.
Hi, I'm Amy Squires, Ben Squires' daughter. Nothing made our dad happier than fighting for justice, especially when he could do it alongside Quentin and Margie and the amazing health and medicine staff. He would be so touched by this award. He'd downplay his importance, of course, but inside he'd be beaming. I just really want to thank you for recognizing him, his passion, his purpose, and his time with health and medicine. Thanks.
I'm Sarah Squires Doyle, and I'm deeply honored to accept this award on behalf of my father, Ben Squires, who passed away earlier this year at the age of 95. My dad served on the Health and Medicine Board of Directors for over 25 years and was always fiercely determined to push the agenda for health advocacy and equitable healthcare rights for all. My dad loved to tell the story that he dabbled in many careers before finding his true calling in public health. He worked for over 20 years on various health initiatives in Chicago and with the State of Illinois Department of Public Health. He was known as the guy with the bow tie, who always wore a smile and had a lot to say. I will never forget one of our early marches through the streets of the Loop, with Quentin leading the charge, my mom and dad by my side, and all of us chanting, "Everybody in, nobody out." As a way to keep his legacy alive and his passion for mentoring young people in his careers, my sister and I are thrilled to announce the Ben Squires Equity Intern Fellowship Program that we will fund with Health and Medicine beginning this fall. On behalf of my entire family, we thank you again for this great recognition of our dad, Ben Squires.